Hi, this is Dr. Mark Agresti. I'm doing a video about what you can tell about people by just looking at them. So in my office, and I work with students and I teach nurse practitioners and physician assistants, and I say you can know a lot just by looking at someone in the waiting room or when they sit down with you. You have to start pulling as much information from just the visual cues you get from someone's coming in. And I'm just going to run through this is an endless list, but I'm going to go through some things you can tell just by looking at someone. Now, I've had people come in and their face is asymmetrical, meaning one side is droopy and one side is up, and they're alarmed. They're like, I don't know what's going on in my face. And over the years, I've seen this many times, and it's usually called the Bell's palsy. And it's a viral attack on the nerves in the face. So one side has less nerve impulses and sort of droops. It's usually just a viral attack, and it's gone in about 2 weeks. But it's really disturbing because they come in, they say, oh, I think I've had a stroke. And I'm like, no, it usually comes on suddenly, and the one side of the face droops, and you just sort of reassure them and say it'll be gone in 2 weeks. Another one that I've seen, this is one of the most common ones, is rashes or red blotches. And I mean, a lot of it is the hydration status. You want to keep your skin good in your face, drink water. But a lot of times people could have digestive problems like celiac disease or gluten intolerance or infections cause skin problems. But alcohol causes skin blotches. Heroin, IV heroin users are snorting heroin, or drug users who have impurities in the drugs, they get red spots and red bumpy spots. Alcoholics get these red bumpy spots. Marijuana users smoking marijuana all the time puts all these impurities in your skin. So you can pick that up right away. You know something's wrong. If someone's coming with red blotches and then the constellation of symptoms, you can look at what else is going on. You can figure out what's going on. If they have a big red nose and they have red spots here, and a puffy face, it's alcohol. Marijuana just doesn't have a puffy face, but just has the red blotches. I get more into that in my book, Tales from the Couch, on Amazon.com. How about facial hair? Facial hair in women usually means a hormonal imbalance, and it's caused by polycystic ovarian disease. And I see that commonly. I say, listen, you're going to have to go to the endocrinologist and get checked out. It usually is little spots on their chin. They start getting dark black facial hair in women. That's a sign that they're producing too much testosterone, and it has a host of other problems. It may lead to infertility. It may lead to moodiness. That's why I wind up seeing them. It can lead to weight gain, blood pressure problems, low blood pressure, low blood sugar, muscular aches and pains. Another one I see when someone starts developing dark spots. The most common reason for that is adrenal insufficiency, not enough steroids in your system. I've seen it with liver failure too. This is a common one. You see it in these models now. There's some models I see it in, and I see it in patients where they start getting those white patches on their skin. It's called vitiligo. It's when the melanocytes are being killed by the body. So the cells that make the skin have pigment get killed. Adrenal insufficiency can also play a part in this. I see rashes in my office where they get these little bumps all over their skin. That's usually a drug reaction or a chemical reaction or a food allergy. It's all over the body, and you know it's chemical or drug or food when it's over the whole body. Contact sensitivity is when it's just in the hand or a certain part of the face where some chemical or toxin just touched part of an area. That's usually a contact dermatitis. But if it's the whole body, it's usually systemic, which usually means it's chemical. The most common thing is drugs or food. I've seen chickenpox do it. Little red spots all over your skin. What causes someone to have swelling of their hands, their feet, their leg, their face? Alcohol's a big one. But what the most common one, and it's more common in women, and I actually see it a lot. I've had 2 cases this week, and usually they complain of fatigue, muscle aches. They all come in. Everyone thinks they have fibromyalgia. It's not fibromyalgia. It's usually hypothyroidism, and I think it has something to do with the toxic environment. And I think this is me speculating. It's not fact, but I'm thinking like implants, like breast implants in the body may do something to the thyroid. But swelling of the face, edema of the legs, where your skin gets puffy and you press on it and it leaves an indentation, hypothyroidism. Hypothyroidism also causes dry skin, your hair to get all gnarly, and your split ends, and you gain weight, you get fatigue, constipation, muscle aches, cold intolerance. But puffiness is usually thyroid, hypothyroidism, low thyroid, and you have total fatigue. Other things with skin, this is 20% of the population. It's virtually 1 in 5 people come into my office, and skin tags or little black marks on your skin, little moles. It's usually hereditary. It's usually nothing. It's usually from light exposure, UV exposure. Could be a hormonal imbalance. But I've had a bunch of these. So if it gets itchy, it gets dark and maybe purplish or dark blue, and has a regular border, and it starts getting larger, and it came on rapidly. It has a raised, it's kind of raised. And when you touch it, it's like a little mountain range on your skin. It has like elevations. I mean, the most common one is basal cell, and you just have to go and get it taken out, but go and get it taken out and then get checked on a regular basis. Then it could be squamous cell, which is a little more dangerous because that one spreads. Basal cell doesn't spread. But if it's a melanoma, that can spread quickly and is very dangerous, and it's a cancer that could be life-threatening. So you have to deal with those things. So you get these little irregular dark patches on your skin, a little bumpy, irregular border. They come on quickly, they itch, they're painful. You got to deal with that right away. Now, what if someone gets, I've seen this, gray blue here. That means I've seen it, people who have anemia, heart disease, the heart's not pumping enough blood. You're not getting enough oxygen, so you get these little gray blue areas on your chin. A lot of smokers get it because they're getting emphysema or chronic obstructive pulmonary disease. So I see it. That's something I see commonly. Here's another one I see. When someone comes in and their eyes are like bulging out of their face, and they look scared, you can't miss it. It usually is a thyroid problem, either low thyroid or a thyroid storm. This one I've never seen. I read about it. Is when your eyelashes get really thick. It's usually from immunodeficiency or tuberculosis. There's other reasons for puffy face. I know I talked about alcohol. Alcohol dehydration is the #1 reason for puffy face that I see. But iodine deficiency, you can see. And how about soft yellow spots right here underneath your eyelash? It means you're metabolizing fats wrong, and it may mean you're a candidate to get atherosclerosis. Now, here's a big one, and I usually see this with women, but when they get a rash right here, and it turns all red and swollen, what I recommend is makeup looks good, but that doesn't mean it's good for you. Makeup is probably not good for you. And you're getting makeup and it's being made all over the world and they put preservatives in it. I would do a test dose of makeup and make sure you can tolerate it. You're not having an allergic reaction to it. And remember, if you're keeping makeup around for a long time and you're using it with a brush and putting it on your face, well, you're taking bacteria from your face and putting it into that makeup. Makeup doesn't last forever, and makeup could be spreading bacteria. Putting makeup is not good for you. and they're putting a lot of chemicals in. Maybe all this makeup is coming from these countries where maybe their standards aren't so great, and they're putting contaminants in it and impurities and toxins that really preserve and kill things. Well, guess what? They're putting things in to preserve and to kill bacteria in that makeup, and maybe it's going to hurt you. So you're better off to use as little makeup as possible, and don't keep your makeup around for a long time. Throw it away. Even if it's full, after about 6 months and you're using it frequently, you need to get rid of that makeup. Acne and blackheads, everyone gets them. I have one thing to say: diet and hydration. You can't have a lot of refined sugars and processed fats. You need to drink water and be real careful with your diet. You need to drink lots of water, and eating impurities and consuming things like tobacco, alcohol lead to acne. But you've got to keep your skin hydrated. Things like alcohol cause hormonal imbalances, and other issues with hormonal imbalance cause acne. You have to be real careful. How about flaking of the skin? You could see that in people. That's usually a hormone imbalance, allergic reaction, or vitamin deficiency. I get this one a lot. Excessive sweating. I've seen it with stress. I've seen it with infections cause it. I've seen it with hyperthyroidism. It's a disease that affects the thyroid. I've also seen it in people who are on opiates or heroin, and they're in withdrawal, and people who are excessive drinkers. The next day they'll sweat profusely. How about when you see someone with a large red nose? Alcohol. That's what alcohol does. It breaks the little vessels in your nose, so your nose gets large and red. I've been reading some other things which are kind of bizarre, like food products. This is just for your information. Rice cakes cause wrinkles because it causes dehydration. You know what else causes wrinkles? I'm really into your facial skin. I don't know, I've had a patient who was an esthetician, and she's been doing it for like 30 years, so she's always telling me the latest stuff. But rice cakes caused dehydration. There's nothing healthy in them. Keep away from them. They cause wrinkles. So does smoking. Smoking dehydrates your skin and causes these wrinkles when you puff, and you get these little suctions. From sucking the cigarettes, you get wrinkles. It dries your skin out. It makes it look all rough and dry. It's not real attractive. Then I realized there's something called sushi face. Julianne Moore described it. She's this actress. There's so much salt in sushi, and the rice itself has a high glycemic index, so it raises blood sugar. And the sodium in the soy, it actually causes a puffy face, dehydration. It's drying of the skin and premature aging. So sushi's not so great. I had sushi last night. It's pretty good because it's not high in calories and you lose weight with sushi, but all the soy in it is not good, and the glycemic index, a lot of rice isn't good. You know what else isn't good for your skin? Dairy. Dairy stimulates oil production, so you get a lot of oil in your face. And also, 75% of the population is lactose intolerant, so that causes acne and eczema. When your body can't digest the milk, and so it causes problems in your skin. You're better off to go with goat's milk, 2% milk, or if you're going to drink regular milk, make sure it's grass-fed cows. What else affects the body is not sleeping well. You don't sleep well, you just wear it on your face. Your face looks drained, bags under your eyes, and it gets puffy. That's what I have to say about skin. I'll end with just some caveats about how to have healthier skin. I talked about problems with the skin. Hydration. 1, don't drink alcohol. 2, stay out of the sun or use sun protection. 3, and keep away from refined sugars and fats. What you could do is put a little retin-A on your skin and then a moisturizer at night. That's a big help. Thank you. There's more. I get into this in depth, and I talk about how when I meet patients, what I can learn from just looking at them in their skin in my book, Tales from the Couch, on Amazon.com. Thank you.